Shabbat Shalom. In July of 1995, when I started my internship at the Johns Hopkins Hospital, half of my call night admissions were dying of AIDS. Many were gay men, and increasingly they were injection drug users. Regardless, they were usually alone and stigmatized in their disease. I vividly remember one gay man dying of AIDS and liver failure on my watch in the ICU. At a very practical level, he had no family to consent for blood transfusions. His clinic providers, who had cared for him for years, noted that his family had universally disowned him in learning that he was gay, and that they perceived he shamed him even further when he was later diagnosed with AIDS. We were ultimately able to deliver his emergency blood transfusions, and we lost him during that admission, with nurses but no family at his bedside. And that was because we had precious little medical leave for AIDS patients in 1995. We had our human touch, which was largely otherwise missing from so many of their lives. By December of that year, December of 1995, the third drug of the AIDS cocktail was finally FDA approved, and we finally had hope. The intersection of that rapidly evolving science meeting deeply vulnerable patients was what drew me to the field of HIV and AIDS. And I'm happy to say, in the last 30 years, scientific progress has been immense. We have therapy today that is one pill once a day, and if taken with vigilance, results in both normal life expectancies and the inability to transmit the virus to others. That is the incredible, remarkable progress of research. Just over 10 years after I was an intern, our inspiring clergy at Temple Emmanuel boldly embraced, ahead of much of the conservative movement, a vision of no closets, only windows. And today, I am proud to stand before you here at Temple Emmanuel's Pride Shabbat. That is the power of faith. Fittingly, this week's Parsha, the beginning of a new chapter, describes the wandering of Jewish people, the serpentine paths traveled toward discovering who we are, who we will be, and what we will stand for. I've cared for patients with HIV for 25 years, and many of my fellow physicians, my research colleagues, and my activist friends are gay. It comes with the profession. And I'd like to think I'm sensitive to the issues. And this past March, I attended a national meeting hosted by the Women's Research Initiative on HIV policies, and I was again, as I frequently am, humbled. About half the attendants were community advocates, and some were HIV infected. Before the discussions were the slides and the statistics. Many of them I knew, but here are some of them. Approximately 7% of the US adult population identifies as LGBTQ. Somewhere between 0.5% and 1.6% of adults identify as transgender. A national transgender household population survey last year reported that 42% of transgender adults had attempted suicide. 81% had considered it. As those facts were presented, discussion ensued, and those statistics actually came to life. We heard the personal anecdotes, like the story from a trans woman who lived in Louisiana and was afraid to go out for groceries, preferring to go hungry than to risk fear of criminalization. I asked her if she found her clinic providers were a source of comfort. To that, she replied that when she checks into clinic in Louisiana, there's an intentional, embarrassing misuse of her pronouns and her name by the front desk staff. I inquired about whether she could report this behavior to the doctor. I was desperate to find her a haven, hopeful that maybe my colleagues in her state might offer her some respite. And she said, "Most of the front desk staff are spouses of the physicians. I would never dare complain." This week's Parsha also speaks to the importance of knowing the rules and the policies, to be aware and to adhere to them. When it comes to LGBTQ policies, how many of us are really aware? How many of you know that as of May 21st, just a few weeks ago, Half of all US states, 25 of them, have enacted laws that prohibit youth access to gender-affirming care. That number has increased from just 4 states in the last 2 years. We need to know and understand the implications of these policies if we're going to advocate for change, if we're going to stand up to those whose voices might otherwise be lost and who might be unduly criminalized just by virtue of their identity. Many of you know that I left clinical care and academia to serve in the Biden administration, and there I got to work with Admiral Rachel Levine, the Assistant Secretary of Health, and the first openly transgender person to hold an office that requires Senate confirmation. We had many wonderful conversations about things both policy and personal. On one occasion, I recall, I callously discussed my travel, a family trip to Disney, a CDC trip to our office in Kampala, Uganda. Regarding Florida, she said, I can't travel there. I'm not permitted to use the bathroom. As for Uganda, she noted, I can't go there either. I'd be killed. This Pride Shabbat, we celebrate the progress, the love, the people, and indeed, quite literally, the rainbows. And yet we are still meandering. We still have so much work to do. The issues are complex, and we have this responsibility to humanity, to each other, and to our faith to open the conversation, to embrace that complexity, and to learn. Here's to more windows and no closets, and to the magnificent, brilliant color of the rainbow. Shabbat shalom.